The liver is the primary source of albumin synthesis, as well as the protein factors the body uses for blood coagulation. If a disease state caused depressed synthesis of albumin in the liver, the lab test would flag hypoalbuminemia. Because albumin is non-ionic and has a high molecular weight, it also has a substantial role in regulating colloid osmotic pressure. This means that with a decreased concentration in the blood, you may see mild edema. Usually though, a disease process causing hypoalbuminemia, such as chronic cirrhosis, will also cause hypertension, and this hypertension will be the main cause of fluid collection. In a state of dehydration or hemolysis, a person will have an increased concentration of albumin. If a disease state caused deficiency in the production of clotting factors in the liver, the prothrombin and or the partial thromboplastin time will be increased. Inadequate supply of clotting factors could lead to impaired blood coagulation, and so prolonged hemorrhaging. Decreased prothrombin time could also suggest insufficiency of vitamin K, which could relate to obstruction of bile due to bile's role in intestinal absorption of non-soluble vitamins. Prothrombin time may also be reported as INR, which stands for International Normalised Ratio. INR is calculated as a ratio of the patient's prothrombin time and a control prothrombin time, which is useful in the case that a person is taking blood thinners. Prothrombin time, albumin concentration, bilirubin concentration, degree of ascites, and grade of encephalopathy are all parameters used in Child-Pugh's classification of severity of cirrhosis. The values of these tests are used to categorize cirrhosis into well-compensated, functionally compromised, and decompensated, with each of these classes having different clinically significant 1 to 2 year survival rates. Globulins are another type of protein produced in the liver, specifically in the Kupffer cells. The ratio of albumin to globulins demonstrates more albumin than globulins in a normal state. A reversal of this ratio, where there's a decrease in total protein and albumin concentration, with an increase in globulin concentration, is usually indicative of cirrhosis. Generally speaking, an increase in gamma globulins commonly suggests some type of chronic liver disease. Alpha fetoprotein is produced by the yolk sac and is present in trace amounts after birth. In non-pregnant people, an increase is suggestive of hepatocellular carcinoma, or in the pediatric patient, hepatoblastoma. So this concludes liver proteins, and it also concludes our short series on liver lab values. Although these tests are termed liver function tests, they aren't ultimately diagnostic of liver function. So in reality, abnormal liver function tests may be caused by disease in other organs, and it's actually even possible to have advanced liver disease without any significant deviation from normal lab values. With that in mind, it's no big wonder why medical imaging has a place in assessing liver diseases. Cheers.